Hello, and welcome. Dr. Adam Breiner here, broadcasting live for another installment of our talk on Lyme disease. I know it's been a few weeks. I hope everyone's having a great summer. And we got so many great, lot of feedback, great feedback on the other broadcasts. So without further ado, let's delve into this, okay? So we're going to talk a little bit about the whole body approach to Lyme. So we've talked already. What is Lyme disease? Clinical signs and symptoms, and conventional testing and treatments, and then the whole body approach, right? We've already started going into the whole body approach. So what have we discussed so far? We discussed things about EAV testing and removing the obstacles to cure. And now we're going to start getting into things like homeopathy and botanical medicine a little bit, and aiding in detoxification. All right, so that is where we're at. And of course, later on, we're going into antimicrobial therapies. So what is homeopathy? I mean, homeopathy is a great field of medicine. It's really literally an entire field of medicine. And to understand homeopathy, you can't talk about it without talking about Dr. Samuel Hahnemann. There's Dr. Hahnemann right down below me on the screen. And he was around in the late 1700s, early 1800s, okay? And he was a physician, really, really bright guy. And he started getting disgusted with the way medicine was practiced, which was a lot of this, what he called heroic medicine, or he actually coined the term allopathic medicine from the Greek term for allos, pathy, from different pathology. Because he saw that when people were trying to treat patients, they were giving them another, like a whole nother pathology just to try and get rid of what was there. They were drilling holes to get out spirits in their head, drilling holes in the heads to get out spirits. They were pouring mercury down their throats to get rid of syphilis, and people are ending up with this whole host of other health ailments. And so that was a really bad thing. So Hahnemann got tired of treating his patients like that, making them what he thought was just sicker. So he gave up medicine for a while, and he was so bright, he was able to translate and speak 7 different languages. So he stopped practicing medicine for a while and just started going through old medical texts, ancient medical texts, and started looking to see, is there anything that can give us a clue of how the body heals? And lo and behold, he started finding this idea of like cures like. And that idea is that which can cause disease symptoms in a healthy individual can remove that in someone who is sick if they have similar symptoms. And then, here's the key, if that substance is also diluted down so there's no more toxicity. Now, Hahnemann was a pretty empirical guy. You see, he wanted to know, what do we do? How do we look at this and figure out, he has a theory, and can he test that theory? He was really one of the first to imply empirical medicine, okay, apply it. So what he did is he said, okay, I know that people who have malaria have certain symptoms. They have ringing in the ears. They have intermittent fevers. So he said, well, what do we use to treat malaria? And at the time they were using quinine, the bark of the cinchona tree, the China officinalis. So what he did is he took that medicine, the quinine, and he started diluting it out, not at the level that they were using for, normally treating malaria, but he actually did it in a serial dilution, which was really key. Okay, so the serial dilution was part of what he did. And then he started giving it to himself, and he was healthy. He had no malaria. He just regular guy, no health problems, giving himself this potentized and diluted form of quinine. And he was very meticulous in writing down all his symptoms and anything that he may or may not experience. And he went and looked at things, everything from the mental, from head, eyes, ears, nose, throat, chest, abdomen, urogenital, extremities, skin. He just noted anything down that could be of interest in very specific ways in the body. And what he found is he started having symptoms similar to malaria, ringing in the ears, intermittent fevers, and he says, oh, wow, look at that. And like most doctors back then, they did experiments, and they decided, okay, how am I going to test this out? He took his kids, took his family, some of his students, and he was able to develop a picture, a symptom picture of how this remedy, how this highly diluted form and potentized form of quinine would look like symptom-wise. And then if he were to then give it to somebody who presented similar symptoms, and it may be malaria or maybe malaria looked like it, and he would give them that medicine, that quinine in those specific doses, he would then be able to wake up the immune system to overcome that disease state. That's the idea of like cures like. Okay, so that's the basis of homeopathy. And it was called approving. This is what would be known as approving. And Hahnemann started doing this with various different substances over time, hundreds of substances, and really developed, the first materia medica of a lot of the biggest used homeopathic medicines that are done today. And again, it was very key that he did something called a serial dilution. So he would take something, let's say that quinine, and he would take one part, put it in, let's say, 10 parts of solvent like water or like an alcohol, and then he would succuss it. So he would take this, he would take the substance, and he would literally take a bottle of the stuff. All right, and bang it on the back of a leather-bound book, like 10 times, 100 times, and then he would take that substance, that dilution, let's say 1 part per 10, dilute it down into another 10 parts of solution, and bang it again, 10 times, 100 times, and that so on and so forth. So that's how he would create these serial dilutions. And in fact, when he became more dilute, the effects became more profound and even on a deeper level, sometimes more on the emotional level as well. So that is some of the things, the idea behind homeopathy. So let me go on here to the next slide. Now, using homeopathics for Lyme, all right, there's different ways we can use homeopathy to help Lyme patients. One is called the constitutional homeopathy, and that's what fits the overall picture. That's when you're looking at a clustering of symptoms, like I mentioned with the quinine that Dr. Hahnemann would use, and he would say, okay, does this person have ringing in the ears and intermittent fevers, and do they have various symptoms that look like this medicine? And then he would give that, okay, so that you can look at various presentations and find remedies that fit that person. And that is constitutional homeopathy. It takes some time to get that figured out for each patient, and but sometimes that is a great way of helping patients. Another way is called isodes and nosodes, and those are if you had the specific organism, okay, or tissue, diseased tissue, that can be a way. You give that in a highly diluted homeopathic form, and I like to call it the Lyme juice. You're giving them almost like a Borrelia homeopathic to help the body wake up, if you want to think of it vaccine-like. Okay, it's not a vaccine, but some of the ideas even Hahnemann referred to. And you can also use homeopathy to aid and support organs of elimination, detoxification. And this is a great way of really helping the body with homeopathic medicines to help, let's say, the liver, the kidneys, the skin, whatever might be, the lymphatics. These are great ways to help with that. And finally, we can target specific toxins by giving the homeopathic versions of that. Now, botanical medicine, all right, next little subject here. Botanical medicine is the use of plants. So we'll use different botanicals for, liver support for the gastrointestinal system, say the spleen, the adrenals, the kidneys. I mean, there's many different organs and many different herbal medicines. We'll use different companies of combined herbals sometimes. For instance, things like companies known as Nutrimedics, Jernigan, Monastery of Herbs, Byron White. These are all amazing formulas that can work very, very well, and we find them and we test using EAV to figure out what might work best for the patient at the time. And sometimes we'll have them take it daily, and sometimes we'll even pulse it. For instance, take it for 7 days, then take 2 days off. All right. Herbs are amazing, have amazing abilities to help fight microorganisms because they were created with so many phytochemicals that can attack these bugs in so many different ways, including helping the body's system eliminate them, that almost no pharmaceutical drug can really match the amazing power of plants. So that's botanical medicine. I know we didn't get into all the details of botanicals, I'm sorry, but it's really a whole field by itself, as is homeopathy. So therapies to help with detoxification. I mean, detox we talked about being so important just overall. So let's give you some examples. Far infrared saunas. These are amazing. Lyme patients find this to be a great help. One of the things with Lyme disease, and some of you may experience this, is that they have circulation problems. They're cold all the time. So what do you do when you're trying to fight an infection? You have a fever, right? But often people's body temperatures are low and they're not really ever produce a good fever when you have Lyme. So going in the sauna, that's one of the effects, is it raises the internal temperature in your body, okay? So that's part of a far infrared sauna. And that's not just a regular sauna, that's a far infrared. So the wavelengths in the infrared spectrum, it's a light spectrum, penetrate deep and also helps the body release toxins from the fat cells. So this is really important. By the way, a little quick insight is that the first 5 to 10 minutes of sweating, that's when the most amount of toxins are released inside a sauna. So infrared, again, one of the best ways to use it. We have a type here in our office, but a lot of people use them at home, or if they can get anywhere that they can sweat, that's better than not, because often people who are toxic have a tough time sweating. So really, really important. So far infrared saunas. The next thing, detox ionic foot baths. Okay, we'll use these to help the body stimulate its ability to detox, and we're using this field in water that helps pull out the toxins. All right, helps pull out the toxins, literally stimulating the body and using a current and energizing cells, and helps pull it out. And some different stuff can show up inside the water, and really interesting and very effective way to help detoxify the body, actually. Colonic hydrotherapy. Here we use this for patients because it actually helps clean the colon out. And you see there on the upper right corner of your screen, you can see you got your colon, but you also have the big detoxer called the liver, and that gets stimulated well with colonics and helps you dump out some of these blocked up toxins. Again, a lot of these are their own subjects and lectures upon themselves. Lymphatic drainage massage. This can be very helpful for people because the lymphatic system is so important for detoxification. So we need to help the lymphatic system go. It's not regular massage, okay? So someone has to be well trained in doing lymphatic massage. IV therapies, chelations, sometimes using intravenous therapies. Okay, IV therapies are ways of giving you nutrients that you may need, because don't forget you need certain nutrients to help with detoxification. And yes, you can do things orally, but sometimes that's not enough. And if you go IV, you're bypassing all the organs of absorption, like the small intestines and stomach and large intestine, all these things that may be compromised in Lyme patients. And these are therapies that people can utilize to help with getting nutrients, but also sometimes they're chelators, and we're lucky enough to have a doctor here that we can do that for our patients, but there are other offices I'm sure that are doing that as well. Again, not needed for every case, but could be a very great therapeutic benefit. And lastly, laser therapies. We can use lasers to help stimulate the body. Here's an example of a laser therapy. Let me just see this here. So we're using a special laser. It's an infrared and red laser. You can see the tracer laser there, but this actually penetrates very deep into the body, and we use it to upregulate our phase 1, phase 2 detoxification, which is part of our liver detoxification cycles, but it can also do many great things to heal the body and stimulate collagen formation, get blood flow going to the area, stimulate the immune system. A really amazing therapy. So, next time we're going to be discussing alternative methods to destroy pathogens, all right, as well as hyperbaric oxygen. Okay, so these are really, these next installment is going to be an amazing things to talk about, because there are really a lot of great ways to help get rid of these pathogens, and using things like frequency therapies, UV photoluminescence, and hyperbaric oxygen can really, really help with Lyme cases. And so I'm going to get into some of that next time, and I hope this was informative for you. I enjoy speaking with all you guys. Oh, by the way, we did have one question I just want to address. One of the things are people say that I feel poorly or I feel sick in the springtime, or I start feeling sick in the fall. I'm like, what's up with that? And the reason being is that you have to understand these microorganisms go through life cycles. Okay, spring being a time where some of their carriers, like the mice and the other rodents and the deer, are reproducing and are migrating, and they're doing a lot of things to help spread they're guys like Lyme, like Borrelia. Okay, so for the Borrelia is going to replicate then. So hence, if it's in a host like a human, unfortunately, they're feeling some of these symptoms as well, and that's when the Borrelia starts going out. Hi, Carla. How you doing? I see you out there. Shout out to you. So again, next time we're going to go over some great alternative healing methods and destroying these pathogens. And I look forward to speaking to you again very, very soon. And we also hope to have a broadcast where we're going to bring some guests on to talk about spraying your lawn for ticks, because I think that's very important. Like, how can you keep those ticks from coming and getting on you in the first place? So have a great evening, and be back with you soon.